Hi everyone, my name is Martina. I'm certified holistic nutritionist, and in today's video we're going to be touching topic that is affecting many people, and that is heartburn. Heartburn is commonly associated with elevated levels of stomach acid, right? But also contrary can be true that small or insufficient amount of stomach acid can cause a heartburn. When people do experience this unpleasant, painful burning feeling, right, they usually reach out to antacids that are freely available for purchase over the counter, or in the more severe circumstance, they do get prescribed pharmaceuticals that contain proton pump inhibitors. I will keep on referring to these as PPI. These two work in a different way. While antacids are actually alkaline salts that neutralize somewhat the very acidic environment in the stomach and can provide quite immediate relief from the pain, the PPIs do work in a different way. They do get absorbed in the small intestine, released into the bloodstream, where they target enzyme that is responsible for regulation of the stomach acid production, right? And as the name suggests, as they're called inhibitors, this is exactly what they do. They inhibit production of the stomach acid, and this is quite unfortunate. Now, when we think what stomach acid is, really, it is one of the most important protective barriers for our human body. On outside, we've got skin that is protecting us, and on the inside, the same responsibility is assigned to stomach acid, actually. And the very low pH, which is 1.5 to 2 in the stomach environment, will make sure that any kind of intruders that may enter the body with the food we eat will not survive the trip farther down the line to the intestine, right? So when this quite important protective barrier is hindered or compromised in some way, that can have detrimental effect on our human body, right? Now, since the PPI, or besides the fact that the PPIs are decreasing the stomach acid production, they can have also multiple other negative side effects. So let's talk about the most common one that people experience. Now, paradoxically, they're supposed to be relieving from certain digestive issues, and they do, but they are also creating different digestive problems, such as nausea is typical one. People have, due to decreased amount of stomach acid, people can have very often full feeling in the stomach, or feeling unpleasant fullness after any kind of meal. They are also creating a gases or burping, which is a lot of time that people experience, right? So this would be on the digestive issues part. But besides that, it is migraine or fatigue and even dizziness that is commonly present with the PPI. Now, in addition to this, they can trigger also stimulate the food allergies, really, since the stomach acid production is diminished. And sometimes it can happen that indigested particles will enter the digestive system and will trigger the reaction of the immunity, of the immune system, that is resulting in the allergies. They can get addictive. And what do I mean by that? That our body gets really used to the suppression of the stomach acid. And when the person stops taking the PPIs, the stomach cell produce even more acid than before, which is resulting even more severe heartburn and even more severe symptoms. So what does person do? Take antacids or PPIs yet again. And here we are caught up in the vicious circle. What is quite unfortunate with the PPIs is that through the suppression of stomach acid, some micronutrients do not get absorbed fully. And that is very primarily for zinc, for iron, calcium, as well as B12. So these are 4 micronutrients that require sufficient amount of acid to be absorbed. And so this can result in deficiencies. Another unfortunate side effect of these pharmaceuticals is that people do, when they do take them over a long period of time, they are experiencing infection in digestive system 3 times more often than the people who do not take any PPIs. So it is clear that this is not a long-term solution, really, right? And the long-term solution needs to come from elsewhere. Do PPIs have meaning at all? Can they be helpful in some cases? And the answer is yes, they can. In special circumstances of severe stomach ulcers and severe pancreatic ulcers, PPIs can be really helpful, and they can prevent surgical removal of the stomach, either in a partial way or complete, right? So this is something when they can be truly meaningful. To be fair, I have to also say that it can be many times quite tricky to say whether the person has stomach acid deficiency or excess, right? Since the symptoms are truly nearly identical. And in such case, the proper stomach screening needs to come into the place. And also the blood work and deficiencies of some micronutrients, which I have mentioned, can really point to direction what is going on in the body. Now, these screenings are not really commonly available in many countries, or, which is the most often happening, the waiting time to get that kind of screening can last multiple months, which is really not helpful for the person who is really suffering quite frequently with heartburn. So how does that happen, that the person is having elevated amount of stomach acid or more stomach acid than is healthy and is experiencing the heartburn? And it hardly comes as a shocker when I say it comes down to the food choices, food quality, and food combination. By the food quality and food choices, I do mean in particular eating predominantly anything between moderately and ultra processed foods, right? These have usually very low quality, and you have a lot of syrups, a lot of bad fats, unhealthy fats, and trans fats, in addition to coloring agents, emulsifiers, additives, and you name it, or you can find in these foods, right? This is not something which our body likes and either what our body needs, and certainly is one of the most important causes of the disbalanced environment in the stomach. Furthermore, these are foods rich in sugars, refined as well as unrefined sugars, such as honey or maple syrup. Eating in excess, it's truly stimulating the acidic environment in the body in general, hence even more stomach acid. It is also bad fats or low quality of fats, especially in the trans fats and fatty foods in general, fried foods, right? So if we eat quite commonly in the fast foods or takeaways where the fried foods included, this certainly can trigger heartburn. And if being persistent enough and eating these foods regularly over a long period of time, this can result in elevated levels of stomach acid. Alcohol is one definitely to be mentioned and is part in this, can take part in heartburn for sure. And furthermore, is it hasty eating and fast eating or eating on the go, rushing somewhere? This is certainly unhealthy for the digestive system on many levels, but is also triggering a heartburn. Insufficient chewing is one of the most important factors to be mentioned, also for the healthy people, right? That we do not chew our food properly. And chronic stress is another one. Now, stress, we know it's unhealthy and it's not really contributing to our overall well-being, and digestive system is usually the first one that is negatively affected by the chronic stress. It can also be a result of multiple infections in the stomach, such as Helicobacter pylori, and especially if they are reoccurring or repeating and returning this infection, this truly can result in elevated levels of the stomach acid, as well as obviously then the heartburn as a result of it. Now, last and but not least is over acidity, the factor that I need to mention that can result so in elevated stomach acid levels as well as insufficient ones. Over acidity of the entire body is not really, it does not occur from one day to another, not even from 1 month to another. It is a result of many years of bad healthy habits and eating habits, even decades really, where we are eating a lot of refined carbohydrates, a lot of refined sugars, a lot of animal products, and eating really foods that are causing acidity, and eating not sufficient alkaline foods that are phytochemicals, such as polyphenols, flavins, or carotenoids, or any other compounds that are typically found in fruits and vegetables. So this kind of disbalanced food or lifestyle really over many years is resulting in over acidity. And yet again, the stomach environment is typically the one of the affected regions. So these are the most common side effects of PPIs, pharmaceuticals, as well as the causes, which I have just mentioned, that can trigger the elevated amount of stomach acid and the heartburn most commonly. So how can we re-establish the equilibrium? For the sake of length of this video, I'll pause here, and on the corrective measures and how to stimulate the self-regulatory processes of the stomach, I will elaborate on in a separate video. So stay tuned. It is all for now, and I'll see you soon. Bye.